We put the final veneers on. You see the big change, big transformation. This is what it looks like. Okay? Look at the difference now. Look at the big change. Those short front teeth, reverse smile. Look at how it's following the lower lip.
Yeah, it's a big difference.
We changed the color. He looks younger.
Yeah.
Look at his smile here. I had to force him to smile before, just so I could see the teeth.
Well, you said he was intimidating before, because now he looks like...
Oh, he's a big teddy bear.
Somewhat of a nice guy. Yeah.
Oh, yeah, he is. He's a great guy. I don't even have to ask him to.
So he walks in the office differently now that...
Oh, yeah, absolutely.
Okay.
He talks about his life. He chit-chats with my hygienist. I mean, they used to be scared. You know, oh my God, you know, see, they look forward to seeing him, but didn't look forward to cleaning his teeth. Now they do everything because they enjoy it. They visit, they talk. You know, he's opened up so much more.
People prejudge when they don't smile. I guess that's the point here.
Yeah.
You think they're angry,
yeah, absolutely,
mad or stuck up or depressed or whatever. I guess so, yeah.
It's a big guy, burly guy like that, not smiling at you. You're going to walk across the street. You're going to change over to the other side of the road if you're walking.
But he's a lot of people.
He is a representation of almost everybody.
Is it more men or more women that come in for this?
It's a close proportion, but women a hair more.
Okay.
I'd say 60-40. There's a lot of men in it. Looks have become such an important part of our life now, more and more, whether we like it or not. It's everywhere. It's on the news. It's in every magazine. Look at your looks. They want you to focus in on your looks, so everyone is. And they're looking at that. So one of the first things they do is want to lighten their teeth. From there on, they realize that, okay, this needs to be done or that. And so we've got different ways of addressing that. Depends on the severity of the problem.
And that looks very natural. I mean, those look like his teeth. If I were to see that, you know, because I told you,
right.
I could spot veneers across the room, and that just looks like a nice smile.
That's one of the greatest compliments, other than the hug, is when someone can't peg exactly, you got veneers. They don't know what it is, but you got a nice smile.
Is it one of those things where they say, I should have done this years ago?
Absolutely. You know, this with ladies, everybody wants to look younger. And after seeing the final result, you say, oh my God, I look 10 years younger. I should have done this a long time ago.
Do you spot it, by the way? Because, you know, you see some people, they've got the bag and the shoes and the great skin,
Absolutely.
and maybe they have an older smile. Do you spot that? And
Absolutely.
what is it that's keeping them from doing something? Just afraid of the dentist? What is it?
It could be afraid of the dentist, but I think the biggest part of that is not knowing what's available to them, what their options are to do something about their smile, because they're pursuing all the other options that are out there. They're doing the nails, they're doing the skin, they're doing the Botox, they're doing the hair, because it's out there. But as far as the teeth goes, who's talking about that? We want to talk about that. We want this information out there. We want them to come in and ask us. Like I said, you know, we'll spend all the time we can addressing your needs, and it's specific for everyone. It's not a cookie cutter smile. We don't do that. Like I said, we take in proportions of you, your nose, your chin, your lips, and make those teeth to fit you. It's not the same for everybody. So there's no cookie cutter smile.
Okay, so you have more photos.
Yeah. Let me show you this other young gal. Really pretty, conscious about a smile again. And this one is very obvious. So here's a young gal that comes in, and she's got these two yellow teeth. She doesn't like, obviously. You know, she doesn't know what it is specifically, what we're looking at, but when she comes in, she says, those teeth are the wrong color and they are the wrong size. They're too small for my face. Now, these are two veneers done by her last dentist. Okay. Now, maybe you could have used a different material. How did they turn
color like that? Because I hear that veneers, they say they don't really stain.
It's not the veneer themselves. I think it's the cement that was used underneath the veneers, because the veneers themselves are translucent a lot of times.
Okay.
So that could be a show through or
something like that.
Yeah, maybe she decided to use some bleaching toothpaste or something to lighten the teeth.
So she just wanted that fixed. What do you see when you look at her? What do you see?
Here's the thing that she's not seeing is, look at the gums. They're just all over the place. They're low in one place, they're high in another place. They're not in harmony. They're not in those proportions we talked about.
So the gums are uneven.
They're uneven.
So you want to make them
exactly.
Okay.
So that's one of the things we did. Here's the final one. Look at the improvement now from here. The little things that we did, the small improvements. What a big change in her smile and her personality. You know, Randy, I love cooking. When I look at a recipe, you can go through a whole bunch of different ingredients in there, and the end result is something that tastes good. Or you could go with just a few simple ingredients, and it's a fantastic result. So I'm looking at that relationship, the ratio, right? Little effort to a maximum result, and that's what we got right here.
And so what do you do for the gums, by the way?
I have a laser.
I mean, how did you even...
I have a soft tissue laser, which does just that. It's meant for soft tissues, gums. You know, there's no cutting, bleeding. It's very simple. I do it at the same time I'm working on the veneers. And so it's a done deal.
Now, what if people are missing teeth? Because I know you do dental implants too.
Yes, we put in implants. We treatment the case with implants, and we do everything about the same time. So we get a good harmonious result for for everything that we're doing at one time. We get all those teeth placed at the same time. The same lab guy is doing them, so there's no change. It's like paint. You know, you can get the same paint, but after years, if you put it on, you'll see the difference. We don't want to do that. We want to do everything at the same time, as many as we can, that we visually see the teeth. Here's another one I want to show you. Even less that we did that made a big difference in her smile. Take a look. Pretty obvious. She's got those stains on her teeth.
What is that?
Fluorosis.
Okay.
She's not happy with her teeth, obviously. She's 28 here. She's had this all her life. Can you imagine her life in high school?
Right? And that's just always bothered her.
Oh, absolutely.
Did she hide her smile because of it, or cover her smile because of it?
She would speak like this, with her hand in front.
Did you pick up on that when?
Every time when I see overgrowth of facial hair in a man that correlates with bad teeth, you know why that hair is
the
there.
walrus mustache.
Exactly.
They're hiding teeth under there.
Exactly. They're hiding that. You know, and then hands in front of the teeth, or a very tight upper lip when they're talking. Like
they've learned to talk and cover it.
Oh yeah, there's tension in the muscle because they're making a conscious effort not to smile or not show their teeth while they're talking. Okay, that's a red signal right there. There's something needs to be done.
So this gal comes in.
Yeah.
And now this is an easy one for you, probably.
Oh yeah, this is not a veneer case. You know, we did a little contouring of the enamel, like I talked about, taking a little bit off here, a little bit there, doing some bonding to cover up. So we didn't change the color of the teeth, just the overall shape. A little bit on the gums. You see how the gums right here have dipped down. They're uneven. So we took care of that. Compare these two. This one's up here, this one's lower.
Okay, so you had to even out those gums.
Yeah, so we did that, like I said, at the same time that I'm working on the teeth. It doesn't take any more time because I'm using a laser here. Look at the final result over here. Look at a big change on her smile.
Very nice.
Look how much more she's smiling. Exactly.
So, I mean, this is somebody that says, boy, I should have done this years ago.
Yeah, and look even less than all that we've talked about before. It's just minor bonding spot, you know, here and there, taking a bit off here, adding a little bit over here. Big, huge difference. It's kind of like we look at the gums too. You want to see a great painting by one of the masters, and then you have this crummy frame around it. You know, the gums are the frame. You want to make sure the frames look good as well.
Good for you. I mean, you're into this.
I love it.
I underestimated you. You know, when I knew you were coming here to talk about, you know, cosmetic dentistry, and I'm thinking, oh boy, this is going to be possibly, you know, not the most exciting interview, but I think it, you know, anybody listening to this can pick up on your passion, on your excitement, and you like this, and you do see people transformed, and it's more. And I think you've presented a great case, and it is more than just teeth.
Oh yeah, I feel this way about it. My staff do. They do. They can see a case coming too. When I'm talking, you know, they won't say anything, but they know where it's going, and we talk afterwards, and they can pick it out exactly. Because
you get excited sometimes where you say, boy, this is going to be good.
Absolutely. You know, when we see, we can picture the end result right there, and you can see where it's going, and I just can't wait. I even tell my patients, I can't wait for you to see the final result, because I know how happy you're going to be.
Is it hard for them to take sometimes? You know, you're smiling, you're excited.
You know, the only...
Where they say, hey, you say this to everybody?
No, not at all.
Okay.
I think they can see the sincerity there.
Okay.
We've done this long enough to where we're catering to each individual as a person. This is good for you. This is what the issue is. This is what the fix is for you.
What do you want people to know about you, by the way, in your town? You know, at the top of the show, we said, you know, this is the Central Valley's cosmetic dentist. What do you want them to know about you? Perfectionist?
Yes. My wife doesn't like that, but being a perfectionist means being a little bit of a pain in the
I guess you want that in your cosmetic dentist,
yes.
But you don't want that, I guess, as a
and
spouse
so
or whatever.
I get my fill of being that pain in the by being a perfectionist at work. So at home, I don't have to be that way.
But you said sometimes you go home and you're still talking about it. You're excited about it.
Yeah, sometimes I'm talking about it.
And she has to say, hey, please, you know, every once in a while.
Yeah.
Enough about dentistry stories.
Exactly. So I talk about it, especially when you finish with the case. That's when she knows that I'm home and all bubbly, jumpy, talking about it the whole time. And we do have to give a chance for the kids at dinner table to talk about their day. So I learn to shut up sometimes, you know.
Okay.
And she reminds me. She's really good about that. Do I have time for one more photo?
Yeah. Okay. One more.
I love this patient to death. She's been an incredible person. She knew what she didn't like about her smile. We knew what she wouldn't like about her smile. Look at the teeth. They're spaced apart. They're different proportions. Colors. Each tooth is almost a different color. She had a crown done over here. That was off. Look at the back teeth. You know, the gums. It's almost everything. Look at how much she's smiling over here. The lower lip is pulled down by her front teeth. Mm-hmm. She almost doesn't want to show everything. And this is me asking her to give me her biggest smile because I want to take a picture. I want to see those teeth. And this is as big as it got.
All right.
Okay, now look at the after picture. Look at how big she's smiling over here.
It's very nice.
Yeah.
It is very nice.
She's a huggy lady. All the hugs came there.
So
And
it's
then
just veneers for her.
this we did veneers. We took care of her gums. We took care of the proportions in the teeth. And we took care of the color.
That's a younger looking smile.
That is a younger looking smile, and that's exactly what she said. You know, she didn't know what it was about a smile, but after we got these on, she could tell the age difference, which is important to her.
Do you find that people start taking better care of their teeth? I mean, once you do this?
Oh yeah, they're more aware. They're more conscientious about their teeth and how to take care of them. They're more involved with their teeth. Before, you know, it's human nature. If there's something you don't like about yourself, over time you ignore it. Your brain just stops seeing it. You know.
Wow.
And then, so but by the
This
time
is
you come
heavy stuff.
Yeah, this is psychology, right? So by the time
okay.
you come to the dentist, you almost don't know what to ask for a lot of times. But the dentist knows, so just go in, you know, because you've blocked it off for so long.
Good
You're not
point.
seeing it. Your dentist knows.
Very good, very good. Okay, so go to Dr. Nagrani. Small things from whitening, contouring, getting rid of some of the metal out of their mouth if that's what they want.
Sure.
Veneers, dental implants. Is there anything we haven't mentioned that you do? You take care of gum disease?
Yes, we do,
Also?
absolutely. Very objective criteria. We monitor, come back in 6 weeks. We see if there's any improvements. If not, we get a little more aggressive. So it's very objective
It's
how we
full
take care of
family
that.
dentistry. I mean, you do
Absolutely.
teens and those kind of
We
things.
do orthodontics too, because a lot of times the
What
teeth.
were you going to tell me about this?
Well, we're getting to the different
I thought I
procedures.
had your life story here.
Yeah, I mean, I got veered off when you asked me about the procedures I do. That's
Okay.
one of the things we do, orthodontics, because a lot of times veneers are not going to take over a problem of teeth that are in different positions. It can only do so much. So we want to get those teeth in the right position. You know, your tires, your wheels, they want to be aligned. You know, one tire in a different position, you're going to put a new tire over it. You're going to bring it back first, right? And then
Okay.
put a new tire. Same thing. That's what we do.
All right. I want to thank you for coming on the show.
you,
Great
Randy.
stuff. Great
Thank
stuff.
you.
And we're having you back to talk about dental implants as well.
Okay.
So again, great photos, and we'll have you back. You've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. For you people that are on Twitter and you want to say something nice about Dr. Nagrani, just put hashtag the Wellness Hour. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.